Finger to nose test. Hi, I'm North Carolina D.W.I lawyer J. Scott Smith, and in this short video, I'm going to explain a test called the finger to nose test. This test is very popular in regard to our Hollywood television knowledge of D.W.I investigations. If you like what you're seeing on this channel, please hit the subscribe button below. The finger to nose test is another divided attention test that some police officers use when investigating D.W.I suspects. It's not a validated test, so there are no scientific studies that back it up. This test is sometimes given to people suspected of D.W.I by alcohol, but most times it's given to someone suspected of D.W.I that is impaired by drugs. It's taught in the ARIDE course. It's a fairly simple test, and the manual states the following. The finger to nose is another divided attention test used to detect drug impairment. Finger to nose differs from the other three tests in that the officer must continue to give instructions to the subject throughout the test. Administrative procedures for finger to nose. The subject must be told that he or she will be given a series of commands, i.e. left, right, etc., to indicate which finger is to be brought to the tip of the nose. The subject must be told to stand with feet together, arms down at the sides, facing the examiner. The officer should demonstrate the stance. The subject must be told to close his or her hands, rotate the palms forward, and then extend the index fingers from the closed hands. The officer must tell the subject that they will be asked to touch the tip of their index finger to the tip of the nose. The officer must demonstrate to the subject how they are expected to touch the fingertip to the nose without actually touching the nose. Demonstrate. When I say left, touch the tip of your left index finger to the tip of your nose. The officer must tell the subject that they're expected to return the arm to the side immediately after touching the fingertip to the nose. Demonstrate the movement of the fingertip to the nose by standing at an angle to the subject so he or she can see the proper method for touching the nose. The subject must be told to tilt the head back slightly and to close the eyes and keep them closed until the officer says to open them. The officer should demonstrate the stance with the head tilted back, arms at the sides with the index fingers extended. Remind the participants they should not close their eyes during the instructions for safety reasons. The ARIDE manual continues as it describes how to record the results from the finger to nose test. Recording the results of the finger to nose test. The results of the finger to nose test are recorded by drawing a map showing where the fingertips landed on each attempt. A line should be drawn to the appropriate circle or triangle to indicate where the subject touched their nose. Suggestion: if the officer draws the line from the place where the subject touches the appropriate circle or triangle, it enables them to draw a straighter line. Well, that about does it for the finger to nose test. I hope that I've educated you.